Today we're going to talk about the most common side effect with Accutane. Hello, I'm Dr. Kolsky. I'm the founder and medical director of Advanced Acne Institute, and our practice is very unique in that we only treat acne. So we're very specialized and we focus only on healing acne. So because of that, we have certain insights that we like to share with others who are seeking the path toward clear skin, and we hope that you find it useful. However, this is not in any way meant to be medical advice. So I often have patients ask me, what is the most common side effect that they can expect with Accutane? So Accutane can have, just like any medicine, can have various side effects, but the most common one that we see is dryness. So that's because Accutane works by drying up the oil glands. They help to reduce the oil gland and reduce the activity of the oil gland, so the production of the oil called sebum is reduced. And one of the most common side effects is dryness. Dryness of the skin, dryness of the lips, dryness sometimes of the eyes and sometimes of the nasal passages. So all of those areas are prone to becoming dry when you're on Accutane. The hair can get dry because the oil production is very, very significantly reduced. So that's by far the most common side effect. And I would say almost every patient, without exception, develops some degree of dryness. Now, some patients develop very severe dryness, and sometimes we have to adjust the medication regimen. But most patients don't. Most patients develop manageable dryness. And in order to keep it under control, there are certain things to use, and we have certain things that we recommend to our patients to keep their skin moist and to keep it hydrated and to prevent any dryness from becoming too significant that it becomes uncomfortable. So the majority of patients do not get to the level where they're starting to become uncomfortable with the dryness. They're able to manage it very well. It's very tolerable. They address the dryness of the lips, which is one of the most profound areas for dryness. The lips probably get the most dry of all the areas, and you have to use a certain regimen to keep the lips hydrated well. And the face is the second most common area and the most severe. And as long as you hydrate well and you do it consistently, that usually becomes not of a significant issue. And sometimes the body can get significantly dry. Usually the dryness on the body is not that significant that it's not even something mentioned by my patients. But sometimes it can be, especially if you have a history of eczema or other skin sensitivities. Sometimes it can become more exacerbated by Accutane, causing more dryness. So it is important to moisturize all of those areas, and also to use sunblock, because when the skin gets dry and sensitive, it gets more prone to developing a bad sunburn if you go out in the sun too long. So that's another important factor. But by far, the most common side effect that we see at Advanced Acne Institute in our patients is dryness, and it's usually very easily managed and usually not a factor that prevents us from using Accutane.